Ladies and gentlemen, to moderate the Frontiers of Health Summit, please welcome to the stage Global Head of Healthcare at Bain & Company, Mr. Norbert Holtenschmidt.
Good afternoon and welcome to the Frontiers of Health Summit. My name is Norbert Holtenschmidt. I'm a partner with Bain & Company and a leader in the healthcare practice. I've also led the Healthy Living initiatives between Bain & Company and the World Economic Forum for 4 years. I'm delighted to be here, and let me actually introduce the topic. In my mind, I've split the word healthcare into health and care. And when we talk about health, what we have seen over the last 100 years, total life expectancy has increased by 50%. So for men, from 50 years to 75 years. Those additional 25 years actually came with 60% of those years as unhealthy years. And that actually means if we really think about health, we need to think about investing into healthy life years. That's the view on health. If we then think at the fundamental issues of care, we actually have 3 of them. First of all, we see an information gap, which actually means a lot of sparse segregated data which aren't pulled together in order to make better informed decisions. 2 is we have real decision gaps, which basically means everybody of us is daily making decisions about their health, about nutrition, about a lot of different things, and where actually the knowledge of healthcare professionals isn't necessarily coming in, or is only coming in an infrequent way. And then third, we clearly have a quality gap. A quality gap which actually means that the cost trending up without necessarily having an appropriate increase in the overall outcome of health. All of this points to that we also on the care side need to actually generate insights that improve care in terms of effectiveness and efficiency. Today, we will talk a lot about scientific and technological breakthroughs. And some of them are actually known. We will know that we will have smart hospitals. We know that we will have surgeries that learn. We know that AI-based diagnostics will help us to give a better diagnostic. We'll also know that AI-based drug discovery will speed up innovation and that treatment over time will be personalized. Today, we want to shed light on health and care from different lenses. It's a data lenses, it's investor lenses, it's nutritional lenses, and let me actually use this time to already welcome our first panelist, Anu. Welcome, Anu.
Thank you.
Anu is the CEO and founder of MyGenome, a company that has pioneered the field of personalized preventive health by making personal genomic tools available to the mass. Under Anu's leadership, the company has actually achieved quite a lot since 2013, and the Wall Street Journals actually quotes your company as one of the global top in the biotech sector. Let me just ask you a question to start. Data availability and integration is a key issue in health and care. What are the data that you are collecting, and how do they actually contribute to health and care?
So I think when you look at where the world is going in terms of precision medicine, I think it's imperative to collect the right kind of data for different populations. So one of the things is that at MapMyGenome, we are trying to collect the right kind of genotype and phenotype information, especially for neglected populations. So for instance, I think Indians are about 20% of the world and only 0.2% of the data. Similarly, I think if you look at the Arab population, it's about 5% of the world, but only about 0.08% of the data is genomic. Genomic data is there. So I think there is an inherent inequality that exists that we need to bridge, and I think that's what we are trying to do. Now, the kind of data that we are collecting at MapMyGenome is essentially that of, when you look at the genomic information, we are looking at both sequencing data, but also genotyping data. But along with that, I think the real value comes when we collect also family history, lifestyle, medications, health issues, and many other things. Now, the reason that we feel that the quality of data is extremely important is that, and the reason why we get it is because we provide that value to the consumer by creating genetic counseling for the consumer and therefore giving them actionable information. Now, all of this, I think ultimately when you collect this data, the integration of all these data types is what makes it very compelling to about 5 different types of stakeholders. And what we are doing now is to have machine learning on this data to start to understand these insights. Now, one of the things you asked was, how does this help these different stakeholders? Does it really benefit the healthcare industry? And I think the real value comes if you take governments, for instance. If you had population-wide studies done for a population, you could actually devise healthcare policies based on that. If you had, let's say, an incidence of type 2 diabetes in this part of the world, you could design both nutrition plans accordingly. You could plan many other things according to that. For the consumer, I think there's clear value because they're getting a real actionable step. They get knowledge about it. But I think that if you think about it from a medical hospital's perspective, I think the value comes from the fact that they'll be able to personalize the whole experience for a patient and therefore better outcomes. And similarly, I think you have for whether it's for pharma companies, whether it's coming up with better drugs. So I think in the end, it's the quality of data that matters. And if we can do that, it's helpful for all, whether it's insurance companies, whether it's pharma companies, and otherwise.
You mentioned diabetes. And we all are aware that there's a huge pandemic actually out there of non-communicable diseases, which is basically diabetes, cardiovascular disease, oncology, a couple of other things. How can the data really make sure that we lower the incidence rates? I'm just trying to refer this back to the overall UN goals and also the WHO goals, and just say, how can we do this? How quickly can we do this?
So I think that's where the real value comes from personal genomics, right? We are looking at things like these non-communicable diseases, and most of these are preventable. I think if you look at what the American Heart Association says, 80% of cardiac conditions are preventable, 42% of cancers are preventable, and so on. So I think most of the NCDs are preventable, but I think there needs to be whether it is empowering the consumer with the knowledge, whether it is empowering, different, whether it's insurance companies incentivizing corporates or otherwise, whether it's governments that creating the right kind of policies, to be able to say that you have this information about your genetics, but there needs to be also knowledge or sharing with these, whether it's medical professionals, whether it's creating genetic counselors, or it's creating other people that will be able to actually tell them what needs to be done. And I think that is where the real value will come, whether in terms of saying, how do we actually reduce this NCDs? We know it's theoretically possible, but to actually implement it, I think can be done either through changes in governments, in medical practices, education, but more importantly.
You're painting a great picture of the future, but what are the obstacles actually to make this work?
Yeah, I think like most new technology, I think there are quite a few obstacles that come into our way. I think the biggest and the most important is awareness about new technologies. So we're constantly coming up. I think someone said, for instance, when in the digital health world, there are 300,000 apps, but not many people know. It's the same thing when you look at new technologies like personal genomics and others. I think how do you create the awareness? You have to make sure you spread it in different parts of the world, in different languages, in different parts. So that's the first challenge, right? Creating that awareness that something like this exists. The second thing, obviously, is accessibility of that data or of that technology. Is it something that people can actually get it? And in our case, for instance, we are making it a do-it-yourself. People can order it online and get it in their house. But even then, if you didn't have the distribution systems, if you didn't have someone like a FedEx or somebody else delivering it, you still are stuck over there. So that is the second part, which is accessibility. The third, obviously, is how do you make sure that it's affordable? So I think genomics has been the most exciting field after, I think, the electronic transistor, because the costs have been coming down so dramatically. But it's still, I think, we are still 2-3 years away before it becomes something that it becomes a non-issue. So today, I think, at least in our space, it is still, I would say, it's still at the $100, $200 mark, which is all right, but it can go down further. But I think the biggest challenge for most people is the fear of the unknown, which, according to me, I think is that if you look at what is, people say, I don't want to know because if I know, something will happen. I said, irrespective of whether you know or not, it's in your genetics, in your genome, right? So I think that the real challenge is telling the consumer that if there is knowledge that you could have known and you did not know, in spite of it being accessible and affordable and you're aware of it, I think then consumer has no one to be at fault with except themselves. So I think for us, it's to be able to say that there is real value in empowering the consumer with the knowledge, but also to make sure that the accessibility, the affordability, and awareness can be spread. So those would be the four obstacles I see.
And is there more of a cultural issue actually accepting this? And in terms of data integration, you have very precise data on the genomic side, and then you're combining this with self-reported data, a lot of other things which you're adding. How do you make sense of all of this?
And I think that's where I mentioned that the reason why we can collect some good quality information is that, and I know that in India, for instance, in the past we would go to a hospital, just give you a name and age, and I think that would be enough, right, to get diagnosed. I think today, at least the way we look at it, we want to collect a lot more information. And the reason people give it to us is that they are getting something of value. So I think there are two ways of looking at anything like this, saying, can you incentivize someone to give you high quality data? And the second is saying, can you create the electronic health records or otherwise so that you don't have to get someone to do that for you? So I think both processes are important. And the way we are looking at it is saying, can we look at clinical and other data that can come to us directly? Can we get at, can we integrate it ultimately with other things that can automatically become part of this solution? So you don't want people to be carrying around files. You don't want people to be uploading in 20 different apps. I think ultimately simplicity is what will matter.
Okay. If we make this all true, what is your vision of health and care in 5 to 10 years?
So if everything went my way, I think one, it would be a completely outcome-based approach. So you are telling doctors you would be, life would be, you would be given the right kind of, everybody would be incentivized based on outcomes. But the way I look at it, I think everybody's profile, whether it's your genetic profile based on your drug profile, all of that information will actually be there, whether you can integrate that with your wearable information and other data points that come in, make it simple for someone to use. I think that would be one thing. But the second things, the other things that I can think about is that if all of this information is available to the stakeholders like decision makers, I think we'll start seeing a much better, more cost, solutions for governments that they can actually make much better decisions about healthcare in general. I also think that we would get to a point where you would have some sort of an AI algorithm that can coach you on saying what the next steps will be in terms of your health habits. So today, for instance, I think we have these apps that will tell you what you do, but you still have to input a lot of information. And most of the time, I input it when I'm doing something right. I don't do it when I'm doing something wrong. Right? How do we make sure that we can do something that can actually really nudge us to the right kind of changes? So I think they will become a lot more consumer-driven. We'll start to see that consumers will be a lot more empowered. But I hope that unless we can see real policies coming in from a regulatory standpoint or medical doctors being actually rewarded for outcomes, I think we might not see all the changes that I hope that we will get to.
Thank you, Anu.
Thank you.
And Anu has been painting very much a picture of what the world could look like, especially by using data in a much better way. Let me actually turn to Jim. Jim Breyer actually is the founder and CEO of Breyer Capital, based in California. And Breyer Capital is an investor in AI, social media, digital health. And Jim, you have been actually spending a lot of time investing into AI and into healthcare in the last years. Jim is also a board member, or has been a board member for Facebook, Dell, Walmart, Marvel Entertainment. It's currently a board member of Blackstone and 21st Century Fox. So really somebody who can speak with depth about where to invest and how to invest. If you're hearing all what Anu says, what is your vision of the future, just to link it to what Anu said? And what are the areas that would require special attention from investors?
Thank you. And Anu, those were excellent comments. So I will offer some reflections as a venture capitalist, investor, backing entrepreneurs, learning from the investment business that humility really matters, particularly when we're trying to greatly advance healthcare innovation. So in addition to my corporate boards, I'm on the board of Harvard Corporation and the Stanford Engineering School, advisor at Tsinghua in Beijing. And my role as an investor, venture capitalist, backer of entrepreneurs in healthcare, and trying to make a difference is to find the very best physicians in the world, be they at Mass General, UCSF, outside of China, here in Europe, Middle East, and combine them with the very best computer scientists and machine learning, usually 25 or 30-year-olds, who love computer science, love machine learning, may have been studying for their postdocs at MIT, but want to make a difference in this new world of artificial intelligence where it intersects healthcare. And so part of the wonderful investment landscape and opportunity, I believe, in artificial intelligence and specifically healthcare is to work very closely with the top education institutions, work with the very best medical and academic centers, but also apply a for-profit model where as investors we can be patient, and I've mentioned to many people here, it might be patient for a year or two or three, but when we're trying to revolutionize cancer outcomes, physician advice, advice to patients, we have to be a little impatient on the progress of how these companies operate, how they work with the best medical schools in the world, the best physicians, and really make a difference. And so I'll give a couple of examples of how I view the artificial intelligence healthcare landscape. There's a group of outstanding MIT, Stanford computer scientists who were very successful at many of the Silicon Valley leaders, Google, this company down the road from you in Silicon Valley, Apple. They believe in the mobile device, they believe in algorithms, and they want to make a difference in healthcare, but they know without the right physicians, without the PhDs in neuroscience, the machine learning necessarily, no matter how advanced, won't make a difference. So there are two challenges that are simultaneously presenting great opportunities as investors. There is tremendous amounts of big data and on-the-fly data around medicine that is being created in China and elsewhere in the world. But on a macro basis, that's a very small element of how I believe we're going to change healthcare for the better. There are hospitals and researchers at Mass General, Stanford, UCSF, MD Anderson that have the best cancer data in the world, but it's proprietary. And so many of the best artificial intelligence opportunities and investment opportunities for all of us who want to make a difference is marrying those truly exceptional cancer centers and academic centers with an understanding that, one, MD Anderson, Harvard Medical School, Memorial Sloan Kettering, they have to start partnering at a high level and at the hospital level and at the patient level. And hospitals and academic centers haven't been wonderful partners historically. I can say that about many of the esteemed institutions I work with, Harvard and Stanford and others. So part of the challenge, but the opportunity for all of us as investors, it will be entrepreneurs around the world that revolutionize many of the AI outcomes. There's an understanding that we need both the macro data to be shared, but also on a hospital and academic center, center by center, whether it's thoracic surgery, whether it is other elements of pathology, computation applied to these areas also has to be very specific and bottoms up as well as top down. And as an investor, that's what I'm trying to do. I'm trying to find the very best physicians, cancer researchers, potential Nobel Prize winners in medicine and chemistry, and have them work very specifically with the brilliant computer scientists out of Apple and Amazon and other parts of Silicon Valley, Cambridge, Massachusetts, Beijing, China. And that's what's such a wonderful journey as I reflect upon the opportunities.
Where do you see the most innovation coming out in the next, let's say, 3 to 5 years? If I go back to my introduction, I've basically said, a couple of things we know already are knowable. I think much more on medtech side than on the pharma side, where it might take a little bit longer. But what's your perspective there?
Well, it always takes longer than we think, based on my experience in Silicon Valley, but it, in hopefully many cases, becomes more fundamental. And whether it's education institutions, online learning, healthcare, the big breakthroughs will start where there are clear applications early. I believe computational pathology is an area where I'm seeing opportunities 2 to 3 years from now. So we need to start with certain milestones, but geographically, San Francisco Bay Area, the Southern China Bay Area, and then the academic centers, Oxford, Cambridge, Harvard, MIT, that's where medicine is being revolutionized, where there's also great talent in terms of technology development. Those are the geographies I would bet, which I am doing, as an investor, a lot of money over the next 5 to 10 years where we can make a profound difference. And I've mentioned to several of you, 10 years from now, we could dream for a moment of the 20 largest market capitalization companies in the world. I believe 18 of the 20 will be US and China, and over half will be medical AI oriented. And those are my bets as an investor.
Good. You are putting a lot of bets, if I interpret you right, on the medical side. I've also said in the beginning there's a lot of issue on the health side, because that's actually what healthcare systems can't afford. Healthcare systems can't afford the 25 years unhealthy life years, which we are adding over time as we are getting older. So what are the things that you are envisioning on the health side? Because that's actually where we need to reflect and move, let's say, the consequences of a potential negative decision of the future into the here and now, where we make the decision.
As an investor, I keep learning again and again. It's important to know what we don't know. And from a healthcare system standpoint, there's so much I don't know. What I'm really excited about, though, is how these technologies, when implemented with doctors, are going to improve both the doctor recommendations, the costs of doctor visits, the cost of hospital visits, and instead of people going to emergency rooms in the United States, as they often do, to get health care that they desire, I really believe many of these technologies are going to fundamentally not only improve doctor and patient recommendations and personalize the recommendations, but because of the automation and the ability to use, again, these devices, AI, the cloud, it will take longer than we think, but I'm very optimistic in fundamental positive changes occurring in medicine, in AI, and also in the world of education, which is intertwinably combined with healthcare.
Okay. How do you then envision this will impact the traditional players? You know, healthcare so far is pretty siloed. We have the different players. You know, how will this actually change healthcare, the healthcare landscape over time?
Silos need to be broken down, particularly in healthcare and academics, as well as in universities. I spend a lot of time on campuses. There are many campuses I visit where I cannot get the chemistry professor who's brilliant to speak to the medical school faculty member, to the physicist. And so these silos, these barriers, because of the interdisciplinary skills that are required, are going to gradually be broken down. And in fact, for the traditional providers, there needs to be a rethinking of how they're organized and how the innovation occurs, because they're protecting revenue and balance sheets in many cases, and that's not where breakthrough technology innovation and healthcare innovation and academic innovation will occur. It'll occur with new players and with companies and institutions that understand innovation will cannibalize and change the nature of existing businesses. And that's very exciting, and those are the teams that are, I believe, going to revolutionize academics in medicine.
Good. Perhaps one question going back to Anu's point in terms of genomics. Genomics are personal. When will personal healthcare be a reality? I know we are perhaps asking for a long time period, but what are the elements that you are seeing there?
Again, these are the wonderful debates that we have across dinner tables in Silicon Valley. It's a little bit like AI. When does AI surpass human intelligence? Most people think 2050 is the year. With the personalized medicine, my belief is by 2025, we're going to see fundamental positive implementations of personalized medicine that will make a difference for patients and doctors.
Okay, good. Thank you, Jim.
My pleasure.
Let me actually turn over to Mark Garber. Mark is the chairman of the GHP group in Russia. Mark is a physician by training, and he came actually across during his career across many, many different kind of industries and oversaw programs of modernization of industries in Russia. Mark, as an investor, what are the key challenges that you are seeing for health and care globally, but also in Russia specifically?
Well, thanks. I don't distinguish Russia from the rest of the world because actually we have one big lab today. And even scientists who are assigned to some specific country are no longer considered to be scientists because it's quite an international meaning. And they migrate from lab to lab. And so it's more an issue of their specific area and knowledge rather than the passport. That's why it's so interesting that we are here when we understand that there are changes happening in this area and there is a desire to move this scientific part as well ahead. And I foresee a lot of international scientists to appear here, and maybe next year we'll see some of the big names here reporting on their achievements. But coming to the point of what I would see as an investment opportunity, as an investor who had experience different areas. We are talking about the horizon of 2030. So in 10 years, life would be different, of course. And what Anu disclosed for us in the genetic area and the idea of IT that we are foreseeing, it's amazing. And basically, we are coming to the moment when our body is going to be generally healthy, one way or another. I hope we achieve this. Now, the question is, and here I would refer to a joke, when the old lady asks her granny, tell me, what's the name of this guy I'm crazy about? And he answers, his name is Alzheimer. So the problem today is that, yes, we can potentially, with all the achievements, preserve the body. The problem is how we preserve the brains, how we preserve the consciousness, how we preserve the feeling of life. And yes, we are facing an increase in life expectancy today. But would it be a happy life if we wouldn't understand the meaning of this life? So having said that, I would refer to the issue which I see as one of the most important and challenging areas of investments, which this is the neurodegenerative diseases in broad way. And here, probably 60% of these diseases are referred to Alzheimer. I would not burden the audience in giving the title for the others, but generally we're talking about dementia as a general meaning of this state. I would give you a figure which is pretty threatening. Today, the world pays roughly $1 trillion for the support of the patients suffering from dementia. According to the most moderate forecasts, in 10 years, we're going to spend at least twice as much. So we're talking about $2 trillion plus that the world will be forced to allocate to the treatment of these patients. And those be not healthy people. So this would be causing a lot of disasters in the medical care system because it's a lot of labor force to be involved in that. The way to prevent it is to find the drugs that would help us to fight these very dangerous diseases. And here we face a serious problem. When looking into pharmaceutical studies and to biotech today, the entry ticket for the investor starts at least at 50 million if you want to do it by yourself. And I think my colleagues can prove that this is probably minimum of possible amount. So you cannot do it by yourself in many cases. And moreover, the success of your investments is not granted because now we have a lot of competing research that is done in different countries. And you might spend your 50 million and then nowhere because the neighbor will be more successful somehow. And the big pharma is going to pick that substance or the drug that emerges from this study. So the only way is to invest into the big specialized funds or to deal with the funds that are attached to the state sovereign funds. And here I'm coming to the very interesting point because now science is becoming closely associated with the health programs of the states, with the planning that is made on the state level, specifically meaning this area of brain research. Now, to give you the idea how today, generally, the pharmaceutical study is done for the generally finding of new medicines, there are special libraries, so-called. These are libraries of substances that are prepared by the big pharma. And then whenever the scientists find the target, and this might be some, say, protein that causes certain problem, you have the ability to use this whole library to find which substance is acting against this specific protein to neutralize it and to achieve the medical goal of that. And this is fine for the body. Now, for the brain, it's a bit different because our brain is protected by so-called blood-brain barrier, which is good in our everyday life because this barrier helps us to avoid all the bad stuff we eat and drink and we breathe with. But in case of medicines, it's a big problem because we cannot get through this barrier. And there are no libraries that are specialized in these special substances that can get through BBB. So the idea that we are looking now and we investigate and planning big investment is to create the special library for BB permeable substances that can reach the brain. We want to have roughly from 1 million to 1.5 million substances in this library that would be achievable to researchers worldwide and that would help to facilitate the creation of the medicines that could fight these dangerous diseases. In our initial research, we've targeted 2 companies that are working closely with our fund, and we're trying to also boost research in Russia. So this one company is based in Moscow and in Boston, and the other is in Moscow and in San Diego. This is the nature of today's reality. So we're going to invest into creation of this new basis for the research that will help us to achieve our goal in the forthcoming few years.
Good. You are mentioning one important point, and when we think about Alzheimer's, when we think about the neurodegenerative diseases, the pharma industry has spent so much money on this, billions of money, and not getting a lot out of it, quite frankly. So what you are actually saying is, let's invest in this together, or how do you envision, that this can actually work?
Yes, exactly that's what I'm saying. I'm saying that we come to the point that the today separate efforts are no longer efficient. This is much more profitable to put efforts together and to create the basis that would have the open platform. It's in a way like you have in computer sciences. Open platform is much more efficient, and I think that's what we're talking about. Whenever you have something that gives chance to be open to the rest of the world, and we see it with Elon Musk, who is very open with what he gives to the rest of researchers. They're free to use that. That's the case. But in our situation, it's a bit different. I wouldn't be 100% truthful if I don't say that having the library and giving chance to use this to the big pharma, you generate some income. So it's not 100% charity.
No, that's what you wouldn't expect, but are there different roles actually for the public and the private sector to play?
No, I think that the private sector definitely would be interested in returns, because otherwise it wouldn't be a private sector. But equally, I think that the sovereign funds, and I appeal now to sovereign funds, are also seeking some returns. So whenever you have the right goal, you have the right return. That's an interesting thing. We have the pure science that works on the target in this case. But to prepare the ground to hit the target, we need a very understandable, solid research that is acting on the commercial basis.
And given how important the Alzheimer's, and I would clearly say pandemic actually is, that is on the horizon, it's very important to actually bring all the forces together to fight this fight and not just to split up.
Absolutely, yes.
Yep. Good. With this one, let me actually turn to this region here and welcome Ayman Tamer.
Thank you.
Ayman is the chairman and managing partner of Tamer Group and the board members of the Saudi Arabian Japanese Pharma Manufacturing Company. Previously, Ayman, you have served as a board member of different prestigious boards in the region. And perhaps I can, and I know you have prepared a couple of graphics which actually help to illustrate a little bit also the region for us. But why don't you share your perspective of what are the biggest challenges in health and care in this region, and how scientific and technological advances can actually address these challenges and move to the next level and create a common or good vision for the Middle East.
Thank you, Norbert. First, I'd like to start by thanking everybody. It's a real pleasure to be here with you. I know you're all tired. It's the afternoon, so I'll try to be clear and short. I'll address your questions before I attend to the presentation. Today, our biggest challenges really in this region, including Saudi Arabia, is the challenge of NCDs, non-communicable disease, mainly hypertension, diabetes, obesity, cancer, and to a large extent, even psychotropic diseases. It's on the rise, and it's costing our economy a lot. According to statistics, there's about 40 million lives that are lost every year worldwide due to these NCDs. In Saudi Arabia, 30% of the population or so is suffering from diabetes. Another 14% are near borderline, which means half of the population are at risk. Now, all these NCDs are costing us a lot, and avoiding them through prevention is a key issue. So I could not agree more with you, Norbert. We need to separate healthcare from health lifestyle. I think there are two different things that need to be addressed separately, although they go hand in hand. The other big challenge Saudi Arabia is facing is finding a sustainable model where we can find a model that we can sustain during this transformation phase. We're introducing new technology, and we want to find the best way of introducing it. Another challenge are the number of healthcare professionals available. There is a shortage of nurses, technicians, doctors, physicians, you name it. And today we have about 250,000 healthcare professionals in Saudi Arabia, more or less according to the MOH Ministry of Health statistics. Of these, half of them are at the Ministry of Health, and the other half are at the National Guard and other ministries and private sector, including National Guard, university hospitals, and to name. 23% are physicians, 32% are nurses. In the MOH, 50% are nurses. According to WHO, we have a shortage of approximately 150,000 nurses, so a large shortage in the healthcare provision sector. This will be a challenge that we'll need to face tomorrow. Now, I'd like to go to my presentation and share with you some numbers. They're only 8 pages, so I will not bore you, I hope, and I hope it'll be informative. Clearly, Saudi Arabia is undergoing a transformation like anywhere in the world, and it will have an impact. And this impact, this new innovation and disruptive innovation will generate new investment opportunities in the region, definitely. But at the same time, it has its ticket. Next. Saudi Arabia today and the GCC are moving towards a universal healthcare system. They are focusing on quality, accessibility, and availability. Saudi Arabia was the first GCC country to introduce mandatory insurance, followed by Abu Dhabi, and most recently Dubai. Focus will gradually move towards affordability of healthcare. And when we mean affordability, we have to ask what's the benefit in the healthcare. So it's a cost-benefit review, and move towards a cost-effective, demand-driven, data-driven model. So today we stand in the middle. We have a digital information system. We have patient records, but they are not totally unified. They are at the Ministry of Health, and the Ministry of Health is making a lot of efforts in trying to unify these patient records. The reason to have patient records unified, then we can collect large number of data and have informed decisions. We need to move towards a model of having servers, having cloud-based technology, where we could have access of information to all stakeholders to better understand the size, the magnitude of the disease, and how to better manage it. The Saudi Ministry of Health has a clear e-health strategy, and that is, it's on a 5-year roadmap, and it's to care for patients. When I mean care, through Wasfati, they are today dispensing of pharmaceuticals and medical products going through directly only through the MOH sites. Tomorrow, the Ministry of Health will be able to allow any patient to obtain his medication from any private pharmacy, and the dispensing or the reimbursement process is already in place. This should start very soon, before the end of this year or the beginning of 2019. They want to connect providers. Again, I come to the point of health information or health records. If we don't have unified coding, if we don't have unified health information records, then we cannot manage data. If we cannot manage data, we cannot manage our costs efficiently. Again, it's part of the circle. We need to measure performance better. And here, the private sector should take the role of measuring performance, while the regulators should monitor the performance. So transforming the healthcare system and having a proper standard accreditation is underway. The National Transformation Plan as well and the Digital Transformation Plan are putting emphasis on the private sector as well as foreign investment to help finance and boost this new opportunity. So we will need to see reforms in our regulations in order to attract both foreign investment and private investment. We need to look at more collaboration between the public sector and the private sector to encourage not only health services, which are underway being privatized today, which is part of the 2030 vision, but we need as well to emphasize health education. We need to care for our patients. As I mentioned, NCDs is costing us a lot. And if we don't place emphasis on patients, on educating them, in order to encourage prevention rather than curing disease, we're not going to solve our ever-challenging health issue. We also need to focus on healthcare professionals. Despite the fact that we have a shortfall, we also have a shortfall in their knowledge. Healthcare professionals need to know and learn more about the use of new technology and about standard medical protocol. Just a simple example. My sister was diagnosed with cancer about 1 month ago. She had symptoms 2 years ago in a hospital in Europe, without mentioning names. They did not follow proper medical protocol. They gave her a nebulizer thing to breathe, thought she had an asthmatic attack. But any doctor, I'm not a physician, for a patient who's 59, smoker, is a candidate for cancer. Proper medical protocol should call for CT scan and MRIs. Nothing was done. 2 years later, the time she discovers, she's in stage 4. What a cost and what a burden. I'm sure many of you have had similar examples as these. So we need to increase our education and awareness, both to patients and to healthcare professionals. What are the investment opportunities? I'm not going to go through them. Many of you know about them. But there is technology that supports decision-making. Artificial intelligence, as you quite well explained, my colleague on stage. Technology that improves efficiency. Here, it's mostly in the value chain. How do we optimize inventory? How do we optimize just-in-time delivery? How do we have precision, accuracy, etc., and cost-effective medicine? Technology that enables patients through monitoring or other, again, reducing cost and improving awareness and encouraging the avoidance of getting sick. So again, focusing more on rather than curing. Technology that protects against data threats, semantics, so on. You need to have reliable data, and there's a huge investment in the region that is underway in order to boost the technology, upgrade the systems, and allow for such large data to be accessible, to be stored and accessible. And technology that improves remote health, such as teleradiology, telemedicine, etc. Again, I mentioned non-communicable disease. I will not go through it again. We need to generate more education there. And finally, I want to speak that, you know, all this technology is not going to improve our quality of life. All this transformation in technology will not make our lives better, longer, or not lead to happier lives. What we need to do is transform our lifestyles. I personally practice yoga, I exercise, and I try to keep my nerves in place. And the same technology that we live with today is the technology that is stimulating hypertension and other diseases. So we really need to rethink on how we eat quality food, how we exercise, yoga or other. We don't need to retire early. We need to stay active after retirement. According to Harvard study, having good relationship and good friends is very important. And that leads to a good, long, healthy, happy life. So very simple things. Having a proper diet, sleeping well. How many of you slept well today and yesterday with the programs? Again, make sure you catch up on your sleep after the FII. And finally, living a good quality life. I just want to close with a small remark by mentioning the Harvard study that started in 1938 by a professor who wanted to understand during the Depression in 1938, what can lead to a long, healthy, happy life? Well, they discovered it was more than money or fame, but good relationships that led to a long, healthy, happy life. People who were happy with their relationship at the age of 50 were most healthiest at the age 80. So I just want to close. I cannot agree more with Norbert and my colleagues here. We cannot transform our lives, our health with digital innovation, but we can do it with the transformation of our lifestyle and as well having latest technology to help monitor this new lifestyle. Thank you.
Good. Eamon, thank you. Let me use the opportunity actually to summarize what we have heard and actually also invite you to invest both into health and care, but also into your personal health and into your personal well-being. What we have heard today is the following. There's a huge challenge both on the health and care side which is coming up. You know, we all live longer, we all develop more diseases, we all live unhealthy lifestyles, as Eamon also said. So there's a real challenge. No financial system, healthcare financial system, can actually cope with this. And we need to find solutions. Two, there are solutions on the horizon if we are doing it well. And Anu, you mentioned a couple of those solutions in terms of integrating data. There are solutions in terms of bringing the best people from the different silos together and break the silos and really go beyond the obvious, which, Jim, you are also investing in. I think, Mark, something which was very important here as well, you know, let's not neglect, with all of the benefits of consumerization and so on, the real epidemic which is out there on the Alzheimer's side. This one is an additional burden on not on the healthcare system. This is an additional burden on total society in order to be able to finance this and doing things there correctly, pooling resources is of utmost importance. And last but not least, it's a challenge both for the globe but also for the Middle East. Let's actually take this on and again, as a community here, invest into health and into care, but by doing this in a smart way. And I think what we have heard here from the panel is that we need to harness and combine these advances in technology and science by creating economically viable use cases. And those are the ones which are bringing us forward. Let's create those use cases, let's create a roadmap of this, and with this one, change all of our lives. Thank you.